So design thinking, you can say, is another drug to improve the effectiveness, to improve the safety also. Design thinking is going to aid whatever you learn or whatever discipline you are going to use everywhere.
Hello everyone, welcome in the 15th episode of the Med Talk powered by Game of Pharma. Today we have with us a very special guest, Pranav Kumar sir. Sir is the Chief Experience Designer at Praakamya and also Design Thinking and Customer Experience Expert, and also worked with companies like Cipla and Dr. Reddy. Welcome on the show, sir.
Thank you very much, Lokesh and Salman. I'm happy to be with you, talking to you.
What is the design thinking? And it is only for the designer.
When I talk to the people, I'm doing design thinking or I am expert in design thinking. Uh, Even my company name, when they say they see that the customer experience designer, they ask which kind of thing you designed. It is the fashion design or computer design or some sort of creative design we're talking about. So a lot of things people have the notion on design thinking. To clarify that, to make you understand that more, I will give you a very old example. Electric bulb was invented by Thomas Alva Edison. All you know that. But you know how it happened? He did more than thousands time iteration. I mean, making something and showing to somebody and then revising it again, then improving that, make it new product, showing to the people, trying to use that, and then improving that. So this way, uh, it took more than 1,000 time. What Thomas Alva Edison did, actually every time he gone through repetitive improvement, he has gone through a process of understanding how it can solve the problem of real people. So he, because of that, he not only built the electric bulb, he created the whole system to power it, how it can be reached, and the entire business, entire company came out of what you know now, General Electrics. So if you try to see, understand the whole process, what Thomas Alva Edison did is nowadays called as design thinking. So you can say in the recent world, Thomas Alva Edison was the first man to use design thinking process methodology for innovation, creating solution. Nowadays, if I need to make you understand design thinking, it is about a methodology, a system to understand the customer's need, the deep rooted need. Even your customers, the users also may not be able to tell you, because what they can tell, then what they know, they may not be able to tell you the unsurfaced or unarticulated need. Design thinking is a methodology to understand that need even. This is the first part. The second part of design thinking is that it gives you again the process and methodology to develop the solution from the perspective of the user, from the perspective of the customers. And it keep on improving till the level your customer get a wow looking at that product or the service.
So, I would like to have a question regarding this that you told about Thomas Alva Edison. That we all know that the bulb was invented by him, but no one knows the process behind it. So, and again, you told that design thinking is a methodology. So, it's pretty clear that there must be some process behind design thinking. So, would you please explain in brief process behind this design thinking?
You rightly said people know that Thomas Alva Edison invented the electric bulb, but actually electric bulb already existed when Thomas Alva Edison started working that. What he did, he refined it, he made it to the level people can use it. That's more important. So how you define or understand in the process of design thinking? I will give you a word, very simple word, EDIPT, EDIPT. E for empathize, empathy. You all know empathy is walking a mile, wearing the shoes of the others, right? Empathy, understanding the other's perspective. And then D for discover, find out the real problem. Many a times what is the visible problem may not the real problem. Find out, dig it more. What are the real problem? Discover that problem. And third is I understand for ideate. Then this process gives you a framework sort of thing that how you generate hundreds of thousands of idea to solve that customer's real problem. So here we are talking about as many as ideas, possible solution to develop, ideate that. Now the P stands for prototype. What happens once you got a solution? If you go and tell simply to your customers, this is what I made to solve your problem, he may not be able to figure out what exactly you mean. So it is always good to give a physical or visual kind of solution. It may not be workable, but at least it can reflect what you wanted to do, and that will help the customers to really tell you whether it is close to solve their need or not, and can give you a feedback which further help you to improve that solution. So EDIP, and last is test. Design thinking never ends. It is continuous process. Every time you test it, your prototype, improve it, go back to the drawing board. You might require again ideate and develop the different options and go with the prototype to your customer and your user and find out and improve it, improvise it. It is called iterative process. So in a nutshell, it looks like a linear process, EDIPT, but actually it is it is also called British Design Council very famously given a double diamond model. So this has a double diamond model. What I mean by double diamond, initially when you are told to solve a problem of your customer, then you try to understand the customer by discovery phase. So you increase as many as problem, and when you do ideating, that time also you are creating as many as solution option as possible. So diverging your thoughts. So divergent, then again converging. When you are testing, you are converging the entire options, and then again when you are trying to solve the problem with different options, diverge it again. For making prototype, you can't make prototype for all the idea, right? So picks few which is having a higher value. So that again comes to a conversion point. So design council also calls it double diamond approach to design thinking. So there are multiple model, multiple way of defining that or process that, but by and large, if you follow these two, EDIPT model and double diamond approach, you are through with the basic process of design thinking.
Very beautifully, you just conveyed that long process thing in very short term. So just to like make it brief, so from prototype, you mean the basic demonstration of the idea we have, so that we can show it to our consumers or our clients. And by double diamond shape, you mean the convergence, like sorry, the divergence phase is like we have to get many multiple kind of ideas to solve that particular problem, and then during that convergence thing, we mean that we have to choose that which one of that idea is best suited to solve the problem, and we should work on that particular idea, right?
That's right, Salman. It happens twice. So two times diversion, two times conversion. One time you are doing diversion to find out different kind of real problem. The problem which is surface may not be real, so you dig it further, and then you again get multiple options. So find out as many as seems to be real problem, and as a creator, as a businessman, as a marketer, you may not be choosing all the problem to solve. Then you are picking a few problem to solve. That time you are converging in the first half. So there is two part also. You can say this is first part is the understanding part. Second part is the delivering part or serving part. So second part, again, when you are ideating, you are diverging to get as many as possible solution as can. So it is called at least 100 or 1,000 types of solution you should develop, and then converge again what fits best and what is economically viable for you as well, to narrow down, pick a few, and then do prototyping. Double diamond coming from there.
And so, like, why farmer should pay the attention on the design thinking, sir? Like, this question is arising for the process of the like design thinking.
So if you would have these questions few years back, 5-6 years back, I could have told you not required. But if you see what changed in pharmaceutical or the whole global economy itself, the future becomes very uncertain. You don't know, right? You saw last 3 years how this COVID changed the entire dynamics. In case of uncertainty, where things are changing very fast, the very established wisdom doesn't work. Pharmaceutical companies, how they decide to engage, for example, to engage the customer, they develop the brand plan, marketing plan. It take a lot of time, maybe for launching in April, they start in November, October, and then a different level of approval. Finally, it is approved by somebody who is at higher level, at the senior level of that. That's the process, right? But what is the guarantee? What is approved? It's going to be really the best way from the perspective of the customers, and how much money you invest on developing the communication plan, visual aid, or the campaign, or the product, or the patient support patient support program. Huge money you invest. And what if it doesn't work? And you don't have any clue before it is getting launched in the month of April or June or May, whether it will work or not. Then this is the huge cost you are betting on the expertise of your senior leaders. And I said that things are sending very fast. You should have a system, a protocol, a kind of solution. We can go faster to the customer, go and show it, revise it, do that. So your solution should be resonating more with the customer, not necessarily with the top bosses. So this is the something the leaders need to think, that the old wisdom doesn't apply anymore. The old wisdom or your leadership will be sustainable only when your mind, your information system, your MIS is so swiftly able to capture the customer's voice.
So, since we are talking about design thinking in reference to pharma industry, and we actually got the point of view, sir, that we have many benefits in this regarding marketing and everything. But can we please, to just to simplify it, can we please have some real-time examples where design thinking has been proved to be beneficiary in pharmaceutical industry?
And I talked about design thinking in pharmaceutical industry. They said, yeah, this is fine. You correctly take care, but it doesn't work in pharma. People say, no, you do it in the other industry. Pharmaceutical did not happen. I saw a tweet by some user. Interesting tweet, actually. The user, what he says, he posted a photograph of a medicine, strips, right? And what he did, before posting the backside of the strip, he removed one tablet. and then asked, can you find out this medicine's expiry date? Because expiry date was printed just behind that tablet. If you remove tablet, you must have experienced yourself, right? Remove the tablet, expiry date is gone. Many times when you go in drawer, I mean, you find out an old medicine like paracetamol you need in your home. First thing you see that it is expired or not. But many times you see it is not visible. You can't say it is expired or not, because that part is already removed when you picked up the tablet previous time. This was a problem, and this is age-old problem. I think the moment strip was made from that day, uh, still existing. This problem is still there. Nobody has saw that. We were in my previous company when we engaged an IDEO. IDEO is one of the leading company in design thinking. What they did, they spend along with us, they spend a lot of time going through the design process, and they discovered, this is very simple thing, they discovered that if you solve this problem, the adherence problem of the patient will go up, patient experience will go up. And taking clue from that, not only the strip, the change in the packaging was done in the bottle also. Many times you use the medicine, who will go for a spoon? You use the tap of the liquid, right? As a a teaspoonful, 2 teaspoonful, right? And you see that some droplets of medicine remain there. This is the another problem, simple problem, but that is a lot of wastage, lot of ant come into the medicine. The company understood this, and then doing a simple change in the packaging of medicine, improve the patient. You can understand that, right? Now you can use the tablet, you can see the tablet such a way, printed expiry date, name of the product, such a way that even you take the last tablet, the brand name and the expiry date is remain there, company name remain there. So this looks very simple, but huge benefit to the user, to the patient. This is one example. There is a pretty more example. I will give you another example. This example was for the patient perspective. I will give you another example from the prescriber, doctor's perspective. So what happened, we were doing some project on dermatology, and we were meeting dermatologists. We are talking to their patient, their ecosystem, what we call immersion. We used to be there in the doctor's clinic for whole day, right from morning to evening, just watching, listening, talking. And then we saw that many of the patients who were prescribed the topical ointment, right, skin cream, particularly a steroid kind of skin cream, you need to use a proper amount of that. If you are using less, it is not going to heal the disease. If you are using more, it is harmful. It causes many diseases, including the diabetes and osteoporosis. So patient use complaining to doctor, sir, I have been using बहुत साल, sir, बहुत महीना हो गया, अभी तक ठीक नहीं हुआ मेरा eczema. And doctor is giving right medicine. And then we talk to some of the patient. Can you show me how you use that? Patient put pick the tube and applied very small amount of that. Why? Because it is costly medicine, very small amount that. Then I told, I've just taken picture of that, actually how the patient is using, shown to the doctor. Patient don't take the right dose. So what we did, and doctor has huge number of patients. A dermatologist can see even 100 patients a day. And that time, how much time he will give to improve, to tell the patient how to use that, to demonstrate the patient how to use that. So what we did, we made a simple pictorial demonstration kind of aid given to the doctor. Doctor, you don't do anything, just keep it at your waiting room. Patient will come, see you, when you write the product, simply tell him, go and watch that aid and the waiting room, or even compounder, the assistant doctor's assistant can help him to understand. And that has a potential to improve the cure rate, the healing of the skin disease become normal. I mean, as per the effectiveness of the drug. So what you are doing in this example, you are actually improving the efficacy of the drug. Drug is same without changing the molecular formula. Your cure rate is going up. So design thinking, you can say, is another drug to improve the effectiveness, to improve the safety also, because right dose is important in this particular case of steroid, to prevent osteoporosis and many other complications caused by steroid. So this is the two example, and there are hundreds of example. If you call me, I will actually keep on explaining you possibilities for pharmaceutical company in both perspective, doctor's perspective as well as from the patient perspective.
I understood the whole process of the design thinking and how the pharma industry is implementing these strategies into the patient care also. So, like, so after the COVID era, all the things are going towards the digital. The marketing also goes to the digital way. And so, I'm the pharma marketing guy. Like, I'm totally interested in the pharma marketing. So why I should learn the design thinking? What is the function and what is the career in the design thinking for me also? What is the application of design thinking in the pharma marketing?
Actually, very happy to see some of the organization. 2 years back, one of the very premier institution, management college, doing pharmacy and healthcare management postgraduate course also. They called me for a guest lecture. Actually, I should name that Goa Institute of Management, gym. So I went there. So we had time. So before addressing to the student, so they gathered all the faculties of the healthcare management discipline. They gathered, and they just wanted to have a chat with me. I agreed. And they asked me which kind of thing they should include in their curriculum to make the MBA more pertinent, to create the student job market fit. I suggested them include design thinking. And later on, the very next year, I was very happy to see that they included design thinking in the curriculum of the MBA in healthcare management and general MBA also. This is good. Now, question is what the benefit you are getting it. So see, once you come out from your college, go for an interview or campus interview to get a job in pharmaceutical company, the people who are interviewing them, they are looking for some solution which they themselves are struggling that time. I said high cost of marketing, getting always right, whatever communication plan or the marketing plan you are making for the quarter, for the year, it should be hit. Everybody wants that. Every leader wants that. And if you can convince them, sir, I have learned a method, a system which can ensure more accuracy of your communication, more relevance of your brand strategy for your customer, I think anybody, any sensible body will buy it. What I mean when you say buy it, it means that he will buy you, he will give you job, not only job, he will give you a better responsibility, kind of a space to implement that what you have learned. And you know that I think you have must have got convinced with the two example I have given. You can do yourself and find out so many other unmet healthcare need, and can develop, design, and execute the program for the medical education or for the marketing communication or for the patient support program, anything. And that can give you better impact. So design thinking, you make it a point very soon, is going to be one of the desirable qualification whenever pharmaceutical management graduates are going to attend any campus interview to a pharmaceutical company or any healthcare organization.
And sir, likely you said ki design thinking is implementing in the pharma marketing also. Like I think for the students, they are right now in the pharmaceutical management courses or like pharmacy courses. They have to learn the things which are different from their curriculum. Like you said ki design thinking, or we can say strategic thinking, digital marketing, artificial intelligence. So these are the new curriculums which if you can implement in your like daily routine of the job, then you can get the most of the better output compared to the other output.
That is very right, Lokesh. And design thinking is going to aid whatever you learn or whatever discipline you are going to use everywhere. It is a some sort of pervading everywhere to improve your other marketing plan. What you are talking for example, you talked about digital marketing. Digital marketing, if you incorporate design thinking there, your effectiveness of digital marketing is going to be very high. And actually, all the digital marketers, you see a big brand, they all use, without any exception, all use design thinking methodology. All, no exception.
But sir, like students of other colleges like us, we are not that fortunate to get to learn the design thinking in our college. So to get interest and the basic knowledge of design thinking, what are the aids like the students can like us can have to get into like on internet or some kind of specific skills or knowledge that we require to get into design thinking? Can you please elaborate that?
Very good thing is that nowadays in MOOCs, the massive open online courses, there is so many design thinking courses. So I strongly recommend, whether it is edX or Coursera or any other online courses, I strongly recommend all of you to do design thinking courses. At least you audit it. So you don't need to pay anything. I understand that a student life, you have limited resources to invest on. So at least audit it. Same way, there are other organizations. This may not be very focused for pharmaceutical or healthcare, but definitely it is going to help you equally. Some of the organizations are very soon, even I'm involved with one of the course getting launched in human to human marketing. Last year when Philip Kotler and his colleagues have written this new concept book, S2S marketing, design thinking is one of the element of human to human marketing. The last thing I want to say you that design thinking is not something which you learn by just going through a course, listening or watching or attending the class. This is something you need to do. This is something you need to pull your trousers up and go to the pond. Go there, jump in the to like to learn swimming. Even if you learn from the Olympic champion in swimming by listening the lecture, you can't learn that. You have to jump to the pool. Design thinking is like that. This is a skill. So you need to go, do again, learn. So you need to take many capstone project while doing this online courses. You need to try in your own right now in your college. I was reading Economic Times article 2 days back. Interesting thing is saying that one company, big company CEO got appointed, and the caption says that now why the design thinking is important for HR leaders, right? So CHRO, not CEO, I'm sorry, CHRO got appointed, who is expert in design thinking. So design thinking has application in the HRM also. You can find out Economic Times 2-3 days back news somewhere. So application is going everywhere, including your career. So whatever you are going to invest on learning design thinking, it is never going to a waste. You are going to use it in your personal life, your personal study, personal career, as well as your professional life. avenues are limited. I understand that. But in last 2-3 years, there are so many courses came up. Choose anyone at least to make yourself acquaintance with the basic theory and basic concept of design thinking, and try to use that learning in your work, in your studies, in your college, in your businesses, whatever you are doing that.